Well, the weather's going to be nice today and nice tomorrow, but then it's going to be ugly on Saturday, which means the St. Patrick's Day festivities have been either moved to Sunday or, in the case of the Irish Channel St. Patrick's Day Parade, put on hold. They're going to try to find a date to do it. I don't think it can be Sunday because the Super Sunday Mardi Gras Indian thing happens for St. Joseph's Day on that Sunday, so hopefully they'll be able to come up with a date, a 4 out of 5 risk for enhanced weather. And then the next 2 days, Sunday and Monday, St. Patrick's Day, look absolutely beautiful, better than today and tomorrow are going to be. It's the Medicare Advantage open enrollment period, and if you get your health coverage through a Medicare Advantage plan, you need to keep listening so you can learn about an important deadline that happens later this month. Calvin Mallet joins us now on behalf of People's Health to help walk us through the process. Good morning, Calvin. How are you?
Good morning, Tommy. How you doing this morning?
I'm all right, sir. Tell me why it is this is an important time for people with a Medicare Advantage plan.
Well, if you have Medicare, you can only make changes to your health care coverage at certain times of the year. These are called enrollment periods, and there are a few different kinds. We're currently in the Medicare Advantage open enrollment period, which runs from each year from January 1st to March 31st. During this time, Medicare Advantage plans members can make a one-time change to their health care coverage.
What kind of changes can they make?
Well, you can switch to a new Medicare Advantage plan that better meets your needs. It could be from your same insurance company or a different one. Or you can drop your Medicare Advantage plan and return to original Medicare altogether.
Can you switch from original Medicare to Medicare Advantage?
No. The open enrollment period is only for Medicare Advantage plan members. So if you want to switch from original Medicare, you may have to wait for the annual enrollment period in October. However, you may be able to enroll in a Medicare Advantage plan sooner if you meet certain criteria. For example, if you lose coverage through your employer, if you move outside of your plan service area, or if you have certain chronic health conditions like diabetes or heart disease.
Okay, so if you change to a new health plan for 2025, can you change again now?
Yes. If you change plans during late 2024 and your new coverage started January 1st, 2025, you're likely eligible for this enrollment period, unless you've already changed your plan since January 1st. This time frame is ideal for people who joined a new Medicare Advantage plan for 2025 and aren't happy with it. It's another chance to pick the coverage option that works best for you.
So if you joined a new Medicare Advantage plan for 2025 and you're not happy, this is the chance to pick the coverage option that's right for you, right?
Yes. Make a point to use your plan benefits early in the year, especially if you choose a new plan for 2025. Get your annual eye exam or see your primary care provider for an annual wellness visit. Then take the time to reflect on experience. Were you comfortable with the plan's cost? Could you easily get needed medical services and prescription drugs? If you needed assistance, was the plan's customer service helpful? If the answers to those questions is no, you may want to explore other coverage options.
Can you give us some pointers, share some advice for choosing a new Medicare Advantage plan?
Sure. Let's say you're trying to pick between two Medicare Advantage plans. Be sure to check the costs, review each plan's premiums, deductibles, copays, and coinsurance amounts. Then ask, which plan best fits my budget? Consider the coverage. Make a list of health care services you can get most often and make sure they're covered. And then also ask about the extra benefits. Does the plan cover routine services such as dental, vision, and hearing? What about Part D, prescription drug coverage? These benefits bring additional value to a health plan, but only if you use them.
What about considering the plan type?
Definitely. You may be eligible for multiple plan types, so it's important to think through your options. Some Medicare Advantage plans only cover care from network providers with limited exceptions. Other plans let you see out-of-network providers for most covered services, though you generally have lower costs when you stay in-network. There are other types of plan also, including some with special eligibility criteria.
What type of special criteria?
Well, people who have both Medicare and Medicaid may be eligible for a dual eligible special needs plan. These typically have lower costs for medical services and prescription drugs than other types of plans. For example, members in a People's Health dual eligible plan plan pay zero for all covered prescription drugs.
All right, let me take a break. We'll pick it up when we come back. We're talking to Calvin Mallett on behalf of People's Health. It's a Medicare Advantage open enrollment period. If you get your health coverage through a Medicare Advantage plan, keep listening and learn about an important deadline later on this month. And when we come back, we'll talk about other plans with special enrollment requirements. 8:20, time for traffic now, WWL. 8:26, Tommy Tucker, WWL. Beautiful Thursday morning, and we are talking with Calvin Mallett on behalf of People's Health. Medicare Advantage open enrollment period is here, and if you get your health coverage through a Medicare Advantage plan, he's given us some details on an important deadline later this month. So are there other plans with special enrollment requirements, Calvin?
Yes. Some Medicare Advantage organizations offer chronic condition special needs plans. And those are designed to support people with long-lasting health conditions like diabetes and heart disease. To enroll, a health care provider must confirm you have an eligible condition.
And how do these plans support members?
Well, it depends. Some plans have lower copays for specialist visits or certain prescription drugs. Others may provide care coordination services, which help members stay healthy and follow a treatment plan. Each chronic condition special needs plan has different costs, benefits, and support services. So if you consider enrolling into one, be sure to ask what it offers and verify that you are eligible for that plan.
All right, any final advice? I know we got a deadline coming up on us, right?
All right, so don't let the March 31st deadline sneak up on you. It may be your last chance to switch Medicare Advantage plans until October of later this year. Review your coverage options now so you have the time to carefully consider your options and make the best decisions for you.
Finally, if people want to find out more about People's Health, Calvin, how do they do it?
They can visit our website, www.peopleshealth.com, or they can give us a call at 1-800-978-9765.
And I guess we'll also wander into the People's Health Medicare Center, right? 3017 Vets next to Party City in Metairie?
Correct. Yes, sir. They're 8 to 4.
Go ahead.
Oh, I'm sorry.
No, go ahead, please.
Oh, no. Open, no appointment needed, Monday through Friday, 8 to 4.
And you can make an appointment. You can make an appointment if you want. Deadline's coming up March 31st. Go to peopleshealth.com to find out more. Call 1-800-978-9765. Thank you, Calvin Mallett.